PercuTrach, set for percutaneous dilatation tracheostomy. In intensive care, percutaneous dilatation tracheostomy is an established standard procedure. During longer-term ventilation of intensive care patients in particular, it is increasingly preferred over traditional intubation. There are good reasons for this. Dilation can be performed gently and at the bedside in ICUs. Unlike with intubation, the patient can take in food orally during ventilation, and oral and bronchial hygiene become much easier. In addition, the tracheostoma created by dilation spontaneously closes after treatment has been completed. Dilatation tracheostomy according to Trachea is the method used most frequently during this type of treatment. Our PercuTrach PDT set allows this minimally invasive technique to be carried out simply and safely. It offers the ideal combination of a dilation set and different tracheostomy tube versions that are perfectly matched to the set. Each tube version is supplied with an atraumatic inserter, into which a matching guiding catheter has already been inserted. It features a specially designed handle with incorporated protrusions, which guarantees secure handling. Each inserter is matched to the specific tube size. It snaps securely into the cannula. This ensures a precise transition to the tube tip, which permits atraumatic insertion. To use the PercuTrach PDT set, first prepare the patient. After the patient has been sedated, place him in a supine position and support the neck and shoulders in such a way that the neck is hyperextended. An ultrasound exam of the neck region is recommended to specify the anatomical conditions. Disinfect the skin and cover the area around the neck with sterile dressing. After palpation of the thyroid cartilage, markings for the incision area are recorded based on anatomical landmarks, the tracheal rings and the jugulum, to improve orientation. The patient is typically punctured between the second and third or the third and fourth tracheal ring. Now the bronchoscope must be adjusted to prevent the cuff from being pierced in the process. The completely deflated endotracheal tube is pulled until just below the vocal cord level. Here it is reinflated again. For hemostasis, a local anesthetic should be injected. Now a 1.5 to 2 centimetre long incision is made in the tracheal gap, and a blunt preparation of the trachea is performed. Now insert the puncture cannula with the catheter attached into the insertion site. Correct positioning can be checked by aspirating air bubbles using the attached syringe, which is partially filled with saline solution or sterile water. Then slide the puncture cannula out of the catheter and withdraw cannula and syringe, leaving the catheter in place. A kink-resistant Seldinger guide wire is now inserted into the catheter. To do so, first straighten the J-tip of the guide wire by using the dispenser and make sure that the tip does not protrude. Attach the dispenser to the catheter and feed the guide wire into it. It should pass easily with no resistance. Once the guide wire has been positioned, the dispenser can be removed, followed by the catheter. Now advance the short predilator over the guide wire and carefully dilate the puncture site with a slight twisting movement. Here the predilator should be tilted towards the cranium to avoid damaging the rear wall of the trachea. Prior to the next step, the hydrophilic coating of the dilator must be activated with saline solution or distilled water. The dilator with inserted guiding catheter is threaded over the Seldinger guide wire until the safety lock of the guiding catheter reaches skin level. In the process, the proximal marking of the wire must become visible. By pushing forward and back several times, the tracheal opening can now be dilated until the marking 38 French is visible in the tracheal lumen by using the bronchoscope. Next, the dilator is removed together with the guiding catheter. The Seldinger wire remains in the trachea. Now the corresponding Priflex PercuTrach tracheostomy tube with spiral reinforcement can be inserted. To do so, rub the Atraumatic inserter, into which a guiding catheter has already been inserted, lightly with lubricant, and then insert it into the tube. The cuff, which has been checked for leaks, must be completely deflated and coated with the supplied lubricant to ease insertion. Via the Seldinger guide wire, which has remained in the opening, the Priflex PercuTrach tracheostomy tube can now be inserted into the trachea using the Atraumatic inserter and guiding catheter until the tracheostomy tube flange has reached skin level. Next, the Atraumatic inserter, guiding catheter and guide wire are withdrawn together in an arc movement. With the help of the graduation marks on the top of the tube, an individual positioning of the neck flange is possible. By tightening the screw nut, the flange is finally locked. To ensure a free airway, the trachea and tracheostomy tube should be suctioned. Then the breathing circuit with the attached bronchoscope can be switched to the tracheostomy tube, and at the same time the position in the trachea can be checked. Now the cuff can be inflated. Before the endotracheal tube is finally removed, the trachea and position of the cuff should be rechecked via the tube by using the bronchoscope. If the tracheostomy tube is positioned correctly, a tracheal compress should be used and a neck strap applied for fastening. It is a good idea to check the cuff pressure with a cuff pressure gauge and to take an X-ray of the thorax. The PercuTrach PDT set for stepless dilation is available in various versions. The dilation set can be combined with the Priflex PercuTrach tracheostomy tube. Cuff with cuff, suction with cuff and subglottic suction function. Visit our website or contact us for more information. Thank you.